we're going to be talking a little bit about fatigue and how fatigue relates into components of anxiety and depression. And so anxiety and depression is a topic that I think is sometimes difficult to understand from what is commonly known about depression and anxiety. But we're gonna kind of take it into context as to what we typically see. And before we get started, I'm actually going to readjust my program a little bit. If I can get a couple of volunteers, I'm going to do a little experiment. This is actually part of the lecture, so.
Why not?
Okay, 1, 2, excellent. Anyone else want to volunteer? Okay, anatomically speaking, before we do this, I and Dr. Evans and many of you go through healthcare training, do what's called a gross anatomy lab. So you go and you do dissections, you learn about the anatomy of the human body. We also kind of learn the function when we look at the anatomy. And one of the things that we're going to test right now in this experiment is your nose, okay? Now, obviously, we have different looks to our nose. If you look at our family history pictures from generations back, on one side of our family, all you see is a nose, and you're pretty sure you see some eyes and chins around it. Where on, thankfully, my mom's side, they had fairly normal noses, and so over the generations, we've got semi-normal noses. So they may look differently, but as far as the anatomical shape, once you start going back into the brain, it works the same way. There's a nerve in the brain, a cranial nerve called the olfactory nerve, which is the exact same nerve in everybody's brain, okay? So anatomically and structurally, we are all identical to the way things work. So if I can have my volunteers come up, I'm going to have you just do something for me. I want you to take each of these in turn, and I want you to just smell them, and then I want you to answer the question, 1, can you smell anything? 2, is it pleasant? And 3, can you identify any of them?
Okay, so I should go back and
Yeah.
identify as I go, but then she'll
Yeah,
tell
no,
me.
you're good.
Yeah,
You're good.
don't identify it right off the bat. Just if you can, say yes.
Yeah. Sort of.
Okay.
Mm-hmm. Yeah. Alive?
Yeah.
Yeah.
Okay, could you smell something on all of them?
Uh-huh.
Were they all pleasant?
One was not as pleasant, but they were,
Okay, which one didn't you like?
it was either 2 or 3.
Okay, go ahead.
Yeah, I can smell that. Yeah. Oh yeah.
Okay, you smell something? Were they all pleasant for you?
2 wasn't quite as pleasant.
Okay.
They all have certain scents.
Okay,
You can pick out some of them.
okay. So, thank you.
Okay.
I appreciate it. Now, my wife is really into essential oils, okay? I detest these essential oils, okay? And nothing against them. It gives me a headache. Now, I know what all these are, and anatomically, all 3 of us have the same nose structure, the same cranial nerve functioning, but we might have gotten a different experience from them. There's one I like here. It's the grapefruit one. There's actually a grapefruit one. The rest of them actually, one of them when I was putting it in the little vial, I actually had a headache the rest of the day on this one, okay? So what's the deal with that? If we could add time, we had all of us come up here and smell it. My guess is that each one of us would have some different thing to say about each of these and how we feel about them. Why is it that our interpretation of this semi-anatomically similar function for all of us is different? Any ideas? Why would I hate all these and someone else like them? What are some of the reasons we have different approaches to this? Yeah.
You might have associations of those.
Okay, different associations
Life
with the smell.
situations with a certain smell or
Okay, very good. Anything else?
change of brain waves.
Okay, yeah. Yeah, there are different things. The one I like, the grapefruit one, I have a medical problem I inherited from my parents. It's a cholesterol issue, where my liver only takes out half of the cholesterol from my bloodstream. It's called FH, or familial hypercholesterolemia. My medications don't react well with grapefruit. In other words, it blocks the effects of my medications. I love grapefruit, but if I take it, it affects my cholesterol, and it's frustrating. I think that's why I love the smell so much, because I don't think it affects it if I smell it. So I just sit and smell it, and I can't eat it. But so that's a different experience that I've had with this that then translates into how I interpret smell, though anatomically all of us are basically the same. Now when we're talking about being tired and fatigue and anxiety and depression, I want you to remember that point. That even though anatomically, when we're looking at several different bodies in the anatomy lab, they look the same, everything tends to function differently in each individual, okay? All right, go ahead. So the definition of fatigue: extreme tiredness, typically resulting from mental or physical exertion or illness. Weariness, diminution. I had to actually look up the pronunciation. Does someone pronounce that better than me? Anyway, decreasing activity. These are definitions taken from medical textbooks and then from the Webster's Dictionary. I do not think that fatigue is really that simple. I think it's a lot more complex than that. Go ahead. I think all these different things, and these are just 12 different categories that I put together. You can take each one of these categories and separate them off into other things, and these, in a way, could all be some sort of function or stimulus that we have in our environment that can affect our level of fatigue. And we'll get into that, not every one of these, but some of these as we go through. But if you read through all of these things, whether they affect us in a good way or bad way, can then result in our sense or our feeling of fatigue. Okay. This is a poem I came up with last night. Ode to Fatigue. O fatigue, thou art unusual, unpredictable, unfeeling, unfair, and above all, unkind. My wife, she hasn't seen this because she had left Du Bois. She's going to love this. It drives her nuts that in the morning I get up and I'm ready to go. She's more of a flower when she wakes up in the morning. It sort of takes some time, and she's incredibly beautiful as she wakes up, like most flowers are. But for me, I'm more like a dandelion. I'm like a weed. I'm just up, I'm ready to go, and it really drives her nuts. But and again, that's where some of these things come. It's just not fair when it comes to why can't she do that? Who knows? Next one. This, I think, is a good visual of sometimes how it feels to be fatigued and tired. It feels like you're in a maze you can't get out of. I'm doing the things that I think I'm supposed to do and I'm still tired. What's going on? This, I think, is, you take that other slide, we had those 12 different aspects on and how they all kind of play a role in your lives. Sometimes it'll feel like a complete web, making it difficult to move ahead. We did luckily find one place that you can get away from fatigue. I was doing some research last night. This is a place you can go and have everyone take care of all your individual needs, and you're never tired. Unfortunately, in the fine print it says that this place doesn't exist. So we're going to keep looking, and if we find it, we will let you know and send you there. Now, I actually did run across one lady. My family and I were in Jamaica on a vacation, and there was a woman that was on the beach with her 2 small kids, and I'm an obstetrician. I can't help it, but I can tell how far along women are if they're wearing a swimming suit. She had to be at least 37 weeks pregnant on vacation in Jamaica, and that's not a good idea. So I had to ask her, I'm like, what are you doing here? Well, my dad owns the resort, and so I just come down here for my whole pregnancy, and then I go back and have my baby. And my pregnancies are all great. Well, duh. I mean, that would be great. Not everyone can live that way, so the rest of us get tired. So, if you are suffering from fatigue, we strongly recommend, if things aren't going your way, a general health evaluation, where we do a medical history. It's important, if you're suffering from fatigue, to keep track of all your medications. And I put down here herbal medications too. There are a lot of herbal medications that can aggravate fatigue, though they are marketed to help fatigue. You can even bring your essential oils because I do know what they do. It's not, I don't like the way they smell, but I'm learning from my wife what they do, and so we can talk about those things too. Physical exam, oftentimes we can find things on physical exam that can lead to fatigue. And then basic blood work tests. These are some of the common diagnoses for general fatigue. Anemia, which is low iron levels, some vitamin deficiencies, and actually, does anyone want to hazard a guess as to what one of the more common vitamin deficiencies in this area are? Nurses are not allowed. Yeah. Vitamin D.
I'm not a nurse.
Yeah, that's all right. Okay. Why would we have such a problem with vitamin D in this area?
No sun.
Yeah, it's the sun. Even when the sun's out, we're really still kind of far away from the sun. I've had patients who I've got on vitamin D that go down to California for a few months, and their doctors are thinking, what is your doctor in Idaho doing? You don't need to be on vitamin D. What's going on with this? They check their levels and they're shocked. They don't realize the difference of exposure, and we really suffer from that in here. Vitamin D is a vitamin, but we think it also works like a hormone, and that deficiency in that can lead to fatigue. Thyroid problems, diabetes, and as Rochelle had talked about before, sometimes hormonal issues can lead to fatigue. Depression and anxiety are the two that we're going to focus on a little bit with this lecture. We're not going to go over all these other things, but these are very common problems that lead to fatigue. Okay, this is where we're going to do the nose test. We've already done that, but as you can see, anatomically, there are different receptors in the brain that function on smell. Even though anatomically they're the same, we can get different responses from the same experience. Okay, next one. Okay, this is what we're going to talk about for a little bit. This is a cool picture of a synaptic junction, okay? So our brains, when we look at them anatomically, have a bunch of nerves coming out of them. And these nerves get smaller and smaller and smaller to the point that the only way to see them is by looking on an electron microscope. And this is where we see what happens between these two nerves. They communicate with each other, okay? And they communicate by neurotransmitters. And what neurotransmitters are chemicals that go from one end of the nerve to the other to tell the nerve what to do. Okay, so when I'm thinking about cracking a joke during my wife's labor, my nerve says, don't do that. And if it gets there in time, my mouth stays shut. It didn't for the first baby, but it definitely did for the second baby. Okay? So those nerves can then learn lessons when they communicate with each other, and I get smarter with the next one. I did really good on the third one. Now, in these neurotransmitters, serotonin, dopamine, and norepinephrine are involved oftentimes with activity or arousal states. In other words, when I get up in the morning and I'm ready to go, I've got these three working to my advantage. When I've had a long day at work, I didn't sleep because I had delivered a couple of babies in the night, and it's about 8 o'clock at night, and I realize I've got a church meeting to go to, these are non-existent. Okay, it's really hard to get moving because they're semi-depleted from my day. So now the anatomy of this synaptic junction. So this nerve releases these neurotransmitters, and they float over and stimulate this one. Now, it'd be nice if we all functioned the way the anatomy is supposed to work, just like with this smelling test, okay? But each individual is going to have a different response at that synaptic nerve. In other words, this end may not recognize as much neurotransmitter coming from this end as, say, the person sitting next to you does. Or one of the things that our body does, which is nice to conserve, is it recycles these neurotransmitters. So in other words, when it releases it, if it doesn't look like it's going to be used, it takes it back up inside the other nerve ending so that it can conserve. It doesn't just let it go and let it go to waste. And so the individual response we have to this anatomical structure in our body can be different for each person. Okay, next one. Okay, ode to the synaptic junction. Okay? I wrote the same kind of poem. This one's a little bit different. O synaptic junction, thou art unusual, unpredictable, unfeeling, unfair, and above all, unkind. Okay? The same kind of thing relates to fatigue in individuals. Sometimes it's not fair to everybody. In other words, our synaptic junction may function differently than someone else. Okay. So, this is the definition of depression. Severe despondency and dejection typically felt over a period of time and accompanied by feelings of hopelessness and inadequacy. In my entire career, I have never had a patient come in and say, Dr. Allred, I'm feeling a severe despondency, and then going through this definition. They never have done that. Anxiety, a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. No one's ever given me that strict of a definition, but close. But it's completely different. Most people that come in complaining or that end up having depression or anxiety issues don't come in saying these two things. Okay, next one. This is the typical presentation. Someone comes into the office, they don't have anything sticking out of their backs, but they do feel very much like this picture depicts. They'll complain of feeling fatigued. I can't get things done like I need to. I'm tired even when I've had a good night's sleep. My weight keeps fluctuating. Either I'm gaining too much weight or I'm losing weight and I don't want to. I'm having a hard time sleeping. Or my libido's gone down. I don't know what's going on. These are some of the most common reported symptoms I get when the eventual diagnosis ends up being anxiety or depression. Okay, next one. Okay, this picture is just to give you an idea as to what I'm thinking here. We talked about the nerves and the way that that nerve stimulates the nerve next to it. Whenever we get stimulated by anything in our environment, we will have a response. Okay, next one. Now this is those 12 things that I wrote down before. Physical activity, environment, dietary issues, genetics, you can't change that. Mental and emotional issues, habits. When I say habits, things like, are we drinking a lot of caffeine? Do we smoke? Do we use alcohol? Do we stay up at night playing on our phones when we should probably be sleeping? Do we stay in bed and watch TV? Do we do everything in bed? Or are there other things that we're doing that are habits that could be broken? Past experiences we've had, okay? They can affect the way we function. Intellectual activity. Are we actively engaged in reading, studying, challenging our brains and our minds? Do we have financial constraints? Are our jobs really wearing down on us? Marriage and family. Is my marriage suffering? Or are my kids having problems? Spiritual issues. There are actually very elaborate studies. I know we talked about research in the weight gain issue. Some of it's sketchy. But they've looked at spiritual aspects in people's lives in all different types of religions. Those who seem to be actively involved in whatever their religions may be tend to have less anxiety, depression, and fatigue. Some, however, on the flip side, who maybe don't fully understand how their religion and spirituality plays a role in their life, can even be overwhelmed and have more fatigue because of it. And then social. Are we socially involved? Are we socially reclusive? Are there other things that play a role? Can you go back one?
Yeah.
So see how all these different types of stimulus can play a role. Now, if I get bad news about one of my children at school, that actually has a real impact on those nerves that we showed in my brain. It causes stress, and it releases hormones and chemicals and neurotransmitters that can start to overwhelm those nerves in my brain and make it difficult to function. If my son is continually getting in trouble and I'm getting phone calls from the school, the police, and all these other things, it's eventually going to really wear on me and become a real problem. And I might end up having some depletion of those neurotransmitters that keep me alert and functioning. So that's how that all this other stimulus that's going on in our lives can wear on us and eventually make us feel tired. Okay, go ahead. And one more. So what we have to do is we have to find a way to break that cycle of stimulus and response. Okay, next one. So what I encourage people to do, and when my kids are struggling, I actually have been a soccer coach in this area for 10 years, and I've dealt with adolescent boys and young men who go through struggles. And you know how, as a parent, one of the things that I am really appreciative of is other adults out there that'll help my kids too. And so I've had an opportunity to sit and talk with some of these young men who are struggling either with their parents or at school. And invariably it comes down to something going on in their lives that's causing a lot of stress, and they just aren't functioning the way they want to. So before you need to see a physician, I would suggest writing down a list of all the things that stress you out, figuring out what areas you feel like you can work on, and picking one of them to try to make a change with that. Let's just say, for instance, we're going to pick intellectual issues, okay? You know, get a book and start reading a book and just seeing if challenging your brain mentally helps break a cycle. And then as you get on top of that, pick something else and try working on those things. So your list is going to be different than mine, but get a list of things that seem to be a chronic stress to you and see if that doesn't help get you functioning a little bit better. Okay, next one. Now, when we're talking about depression specifically, all those little factors there can play a role in aggravating depression. When I am seeing a patient for depression or anxiety management, you can pick any one of those factors that I've listed, and that has been, one of them has been the primary source of an individual's struggle with depression or anxiety. And we've worked through those things. Sometimes working through those things isn't enough, and we need to move to medications. So there are different classes of medications for anxiety and depression, and ironically enough, a lot of these medications can be used for both problems. So SSRIs, those are serotonin reuptake inhibitors, and they're selective. And so what they do is, as this nerve releases serotonin and tries to recycle it back into the nerve, this medicine goes onto this nerve receptor and blocks it so that it can't be taken back up into the nerve, and there's more available for this other end. So in other words, mood can be elevated. So with depression and anxiety, we actually know down at a biochemical level how that medicine's working. So when these medications work, that means you've got a primary deficiency in your body's ability to manage serotonin. Anyone have any guesses as to what might affect your levels of serotonin? Just go back to that other list. Life. Life in general can deplete your body's serotonin if you have lots of life problems. Okay, these medications also function with serotonin, but they add norepinephrine blockage. These are a little bit more complex antidepressant medications, and they increase the amount of those neurotransmitters in the nerve, and they work. They actually increase the body's exposure to those in the brain and elevates your ability to be aroused and function like you need to and not be so fatigued, and it can also help depression. Tricyclic antidepressants are a little bit older version. They're very inexpensive. They function just through norepinephrine, but they also have some side effects that most people aren't really fond of, but they do work. Weight gain is the main side effect with those. There's other types of antidepressants, one called Wellbutrin that actually functions with all the neurotransmitters, so it's a good generic antidepressant, anti-anxiety medication. And then benzodiazepines, they're more hypnotics. Those are sort of more in advanced cases of anxiety where you just need to take a break from life. We don't use those often, but sometimes they become very helpful in people with chronic depression and anxiety. And because of the fact that they have different nerves than, let's say, I do, if I were to take a benzodiazepine right now, you guys would have a really entertaining lecture. I just wouldn't be able to function, but because my nerves function differently than other patients who I have who are taking these every day, it's okay. Their brain and their nerve function requires that medication to help it function at a more normal level as they work on some of these other lifestyle issues that they're trying to overcome. And as they do that, they notice that they're able to wean down on some of their medications and eventually get off of some of them. So those are the medications. Does anybody have any questions about the medications or treatment of depression from a medical standpoint? Okay, next one. So key is being patient with yourself. If you can be patient with yourself and give yourself the benefit of the doubt that as far as looking at change of being fatigued and depressed, It's going to happen, but it may take time to do that. Now, those of you who may have missed my diet and exercise lecture, there are a couple of other aspects that we need to talk about with fatigue. When we're looking at treating anxiety and depression, let's say that's the diagnosis we've come up with. That's why we're so tired. Medications are only one aspect of it. Lifestyle changes are key, and you have to do the lifestyle changes if you hope to get any benefit from the medications. And then the other thing is counseling. And so what I recommend doing when you're starting off with depression management or anxiety management, start first with looking very carefully at your diet. Check out that diet, see how it's working, talk with a professional if you feel like you need to, and try to eliminate some of the things that make it worse. Now, I'm not going to beat up on Diet Coke anymore, but if we're going to look at something that lights a flame under fatigue and anxiety, one of the #1 things is sugar in any of its forms. So be very cautious about the amount of sugar you're eating when you're really struggling with fatigue. Yes, it might get you going for the next half hour, 45 minutes, but eventually it's going to be a problem. So dietary things, exercise, get out and do something. I don't care what it is. Even if it's just walking, if you're not doing any exercise, get out and just start wherever you can. And eventually, if you stick with it, you'll be able to do more and see some of the benefits from exercise. And then the third thing is sleep. Make sure that your sleep hygiene and sleep habits are where they should be. And then you'll start to feel that hopeful influx of energy, at least in one aspect of your life, that you can start working on some of these others. So that is just me at the beginning of the Boston Marathon. You can start wherever you are, but you can accomplish anything you want to do if you start with something. So start off with getting that list of the things that stress you out and make you feel tired. See if you can't make a change just on your own. If it's really not working, come see a physician, go get a health evaluation, make sure there are no medical problems, and then let's start looking at some other things that we can do to get you to be where you want to be. Okay, that's it. Any other questions? No? Okay, sounds good.